My organization is no different from everyone else's, that there is, I'm not sure that we would say resistant to change, but it's, people want to do well and people like habits, no matter what. Everybody is interested in, that is in healthcare, or the vast majority in the mission that we're there for, which is to improve patient health, patient care. So if one can speak to how this will be an added value and they can see it, it's easier. That being said, I think it's always important never, ever to presume that a change will just slip, we say in French, like a letter in the mail. So how, when we effect change, do we make it that it's as easy as possible in the workflow of somebody, or that it speaks to them, it makes sense to them? And then certainly I think the rate of change, trying to change so many things rapidly, is difficult for anybody to absorb. So that capacity of creating that vision and seeing how to have an agile workforce with meaning behind it is a challenge that certainly is faced in my institution as well. I've observed several times, with several flagrant examples, when somebody comes and says, oh, well, this change, a senior leader says, the VP of IT, it's clear, everybody's gonna love this. The doctors have been asking for this. And and we say, well, what's the change management plan? Oh, there's none. They've been asking for it. And sure enough, it comes up against a wall, because that segment is a small, is always a small segment that are really willing to be early adopters. So I think it's never to presume, no matter how much of a winning idea it is, that change is easy without resistance. And then you can imagine when things are harder. So I think it is the creation of a vision, of a clear vision, this is where we're going, consistency of that vision. Consistency does not go against agility. Consistency of, well, we're heading in that direction, and that will mean that we add and that we add different things along the way, is a consistent vision. And then always having accompaniment for change management, even if you think it's an obvious shoo-in, because it's never a shoo-in.